So when filling out an application for a driver's license or a state ID, most of us are asked if we're interested in becoming organ donors. I know that when I was asked, not enough information was available to me at the counter at the DMV to make an informed decision. Without enough information, people are unable to make educated decisions about where they stand on organ donation and whether they want organ donor on their ID. At my current job, I work at Kaiser Permanente, and I help families process and fill out the paperwork pertaining to organ donation for their family members who have recently passed away or are soon to be disconnected from life support. It's very important for people to understand the process of organ donation so that they can let their wishes be known to their family members before they pass away or before they're unable to communicate their wishes on their own. First, I'm going to talk to you today about the different methods of organ donation. Then I'm going to discuss the qualifications about being an organ donor and the recipient of a donated organ and what could disqualify someone from this process. Then I'm going to discuss the pros and cons of organ donation. So there are two different methods of organ donation. According to the United Network of Organ Sharing, which is more commonly referred to as UNOS, the two methods of organ donation are living donations and deceased donations. Living donations take place when family members, friends, in-laws, or sometimes complete strangers decide to donate a part of their organ or a whole organ in and of itself to someone that they could medically live without. In this type of donation, the donor undergoes surgery to remove that organ or section of an organ to be donated and will go on to live a relatively healthy and normal life post-surgery. The most common types of living organ donations are the kidneys, segments of our liver, and in some cases, a woman's uterus can be donated. Deceased organ donations are donations that take place when the organ donor has recently passed away or is not expected to live very long after life support is discontinued. UNOS maintains a list of organs that are legally allowed to be donated from deceased donors, and that includes the liver, the kidneys, the pancreas, the heart, our lungs, our intestines, and in some cases, even hand transplants or facial transplants. Now that you know the methods of organ donation, I want to discuss the qualifications of being an organ donor or a recipient of a donated organ. I also want to inform you about what could disqualify someone from donating their organs or receiving a donated organ. The qualification process for organ donation is put into place to ensure that the person receiving an organ is receiving the healthiest organ possible. According to Dr. Andrew Cameron, a Johns Hopkins transplant expert, living donors can be relatives, friends, neighbors, in-laws, or altruistic strangers. Living donors must be at least 18 years old, in good physical and mental health, and must have a body mass index of lower than 35. The New York Times actually published an article written by Nicholas Bachelor discussing that the age of a donor does not impact the viability of a donated organ. For deceased donors, the qualifications are different and less stringent. To ensure your organs are donated when you pass away, the Human Resources and Services Association states that you need to register with your state or local agency to be an organ donor. The Human Resources and Services Association also states that for someone to become a donor, he or she has to die in very specific circumstances. Most often, a patient will come to the hospital with a head trauma or post-stroke, still alive and hooked up to life support, which maintains the organ's viability because blood flow is still being supplied to that organ. Once patients are tested and confirmed to be brain dead, the process of organ donation can go ahead and start taking place. For people who are not registered organ donors, this can become kind of tricky. For someone who hasn't been a registered organ donor, the family will still be approached and asked, are you interested in donating your loved one's organs? But sometimes, and in my profession, I have found that family members are so high on emotion at the moment that they don't have enough understanding of the process to be able to make that decision. Disqualifications for living and deceased donors are multifactorial. In her informative book, The Organ Donor Experience, Katrina Bramstead discussed the possible disqualifying factors of living donors. She stated that unhealthy BMIs, previous pregnancies, history of certain diseases and illnesses, mental illness, and even financial hardships are disqualifying factors from being an organ donor. She also stated that some U.S. hospitals even require the donor to have health insurance, even though organ donation surgeries are always covered by the recipient's insurance. This stipulation is put in place because after you donate an organ, you will need lifelong care, and some hospitals want to ensure that you have insurance to cover for that care that you'll need. For deceased donors, the main disqualifying factor is the way in which a person has died, or the person not being a registered organ donor. If someone's not a registered organ donor, like I mentioned, and their next of kin does not consent to their organs being donated, the process can go no further, no matter how badly that organ match is needed. Now that you know about the qualifications to become an organ donor, I want to discuss with you some of the pros and cons of organ donation. According to the American Transplant Association, the benefits for a recipient are multifactorial and numerous. They include better quality of life, increased lifespan, and in the case of kidney and lung donations, those are the organs that actually start working immediately post-surgery. For any donor, there's an altruistic reason for donating your organs, knowing that you've improved another person's life. And some organ donors feel confident knowing that when their time does come, they will have helped someone else live a better life by donating the organs that they can. The downside of organ donation, however, is different for living donors, deceased donors, and recipients. For living donors and recipients, there's a long road of recovery associated with an organ transplant surgery. The path to recovery often includes pain, blood loss, time off from work, financial difficulties, and in some cases, the organ transplant surgery simply does not work. Your body does not accept the new organ, and it will have to be taken out, which is another surgery. For deceased organ donation, there's no major downside. However, in the cases of an organ that is donated, such as an eye or skin grafts that are donated posthumously, it can sometimes impact a family's ability to give a passed away person an open casket funeral. So that is a factor that families take into consideration when they decide what organs are they comfortable donating and at what point in time are they going to do that. So now that we have discussed organ donation from an objective perspective, I will conclude my topic. Organ donation, the process of removing the viable organ from the donor and implanting it into the recipient, has become the forefront of medical treatment and can be a solution for patients with failing organs. Today I have spoken with you about organ donation, the methods, the qualifications, disqualifications, and the pros and cons. So now that you know more about organ donation, you can confidently make the right decision about how organ donation will impact you and your life the next time you're at the DMV and they ask you if you want to be an organ donor. Thank you.